Parkinson's disease is more of a Parkinson's syndrome and it affects many parts of the body. It doesn't just affect how a person walks or moves their limbs. Most people think about it's like a tremor disorder only, and that 20% of people don't even shake. So it really impacts significantly the complex coordination of how the brain sends signals to the rest of the body. And those complex coordinations include the speech center. So many speech impairments, when we think about it in Parkinson's, are called hypokinetic dysarthria. And many of us in the field will subdivide that into dysphonia or hypophonia. Today, we're exploring a topic that's deeply personal for many patients with Parkinson's: changes in voice, volume, and how we communicate. If people have told you that they can't hear you, or you felt like your voice isn't yours anymore, this episode was made for you. Let's dive in.
Dr. Thakkar, many people don't realize that Parkinson's can affect speech. Can you please explain why this happens?
Well, Parkinson's disease is more of a Parkinson's syndrome and it affects many parts of the body. It doesn't just affect how a person walks or moves their limbs. Most people think about it's like a tremor disorder only. And as we've learned from these episodes that we've been doing, that 20% of people don't even shake. So it really impacts significantly the complex coordination of how the brain sends signals to the rest of the body. And those complex coordinations include the speech center. So many speech impairments, when we think about it in Parkinson's, are called hypokinetic dysarthria. And many of us in the field will subdivide that into dysphonia or hypophonia. Now, if someone had a stroke, we usually call it dysphonia. But with Parkinson's, it's usually hypo, which means slow and softer. And Parkinson's disease affects the automatic scale of movements. When the brain thinks the mouth is moving normally, even though the physical output is significantly dampened. So speech changes are typically gradual. That makes it even harder for individuals to notice the shift in themselves.
Well, that makes a lot of sense, because just like how it slows down movement in other parts of the body, vocal cords, there are also muscles that are affected in the same way that, per se, your legs or your hands, right?
So it's interesting you bring that up, because, it's a combination actually of physical and sensory factors. And I want to touch upon some things here, because you brought up about the rigidity of the muscles as well. So the muscles themselves get slower and rigid as time goes on with the disease state. And just as we see the legs get stiff and slow, so do the muscles of the diaphragm, the larynx, or the voice box, and then the facial muscles. So that will inherently physically make it harder to get the words loud enough, and it won't be as clear. And then there's a component of what we call sensory processing issues. So people with Parkinson's also miscalibrate their internal volume. Like they don't know about their knob, so to speak, and their brain tells them that they're shouting or talking loud while the listener can't really hear them. And the third component of this is the cognitive load. So if a person is also experiencing like masking of the face, then it becomes even harder for them to convey those meanings, and they lose the ability to use the non-verbal cues. So there's a lot that goes into play. So the takeaway, I think, is voice changes are real and they're neurological, and they're part of the disease, not just a laziness or shyness.
Well, that's very interesting. So the two components, one is like the physical, the muscles being affected, but also their capacity to measure or their own distortion of what is loud, of their own volume. And so when we talk about speech changes, what are the distinct pieces, voice or articulation, expression, that people should understand?
Yeah, as I commented earlier, speech changes are definitely gradual. And that's what makes it hard for a person to know that something's going on and getting worse over time. So 5 key points I want you to understand about speech changes in Parkinson's is the reduced volume, or also known as hypophonia. And this is the most common symptom we see. A patient may speak in a soft voice. Maybe it seems like it's a whisper. And they often believe that they're speaking normal. The other component is a monotonic or monotone pitch. And the natural melody of one's speech disappears, and the voice lacks that inflection that's used to convey emotion and suggest a curiosity that someone used to have. A third component in Parkinson's is the slurred speech or mumbled speech. Because the muscles of the tongue and lips move through a smaller range of motion, the consonants become soft, and that leads to imprecise articulation. The variable rate is the fourth component, and that's where speech may start to slowly and suddenly speed up. So people can have like this shuffling gait that we've seen in Parkinson's. We can see that in the voice too. And there's moments of either long pauses or hesitant pauses. The fifth component would be the vocal cords. They may not close fully or with enough strength, and that results in a thin, kind of airy quality of voice. So it is important to also get imaging and workup, maybe see an ENT, and make sure, even with the, like an endoscopy with the GI specialist, make sure there's no GERD and reflex issues.
And why would you say it's important to recognize and address speech changes early on?
So we think of Parkinson's as, again, a slow progressive disorder, but these muscles of the vocal cords and the throat, they're small. They're not like our big muscles of the biceps and our triceps and our leg muscles. Like, you can work on your strengthening of these arms and do different types of maneuvers. But with the voice, with Parkinson's, there's other secondary issues, whether it's depression or anxiety. We don't want to go out. Maybe we're not wanting to talk as much with others because we're ashamed of our symptoms. There's something inherent that it really aggravates the speech centers that we just don't want to talk and we're not as motivated. So it's really important to start with early intervention and be proactive. As the speech goes, it's usually more in the advanced stages, but you can do something early on when the neuroplasticity already exists. So a way to safeguard a person's quality of life before the volume knob, so to speak, of the voice is permanently turned down, we want to keep them engaged. So Parkinson's is progressive, as I stated. We need to address the speech very early so that the brain conditions those neural pathways so that we can be responsive to the voice training. So timing, again, is everything. And it's not just early. We want to do it throughout the course of the disease state. You want to prevent a social isolation. That's one of the most profound impacts of Parkinson's, that it's not just a physical issue, it's a psychological issue. When a person is constantly asked to repeat themselves or is talked over in groups, then we become more quiet or withdrawn. So early treatment helps maintain our confidence and stay socially active. And I think that's really important for spouses as well and caregivers to know. Start early with the patient on this, because the vicious cycle that a patient stops talking or not wanting us to talk leads to not just atrophy, but then again, it affects the relationship, right? So I think it's important to improve our self-esteem, keep the mood up. We don't want to be isolated. But what we also see is speech comes before social anxiety. So let's exploit that neuroplasticity. Let's keep the brain recalibrated, make sure that sensory pathways are also improved. And then, as I mentioned before, patients often feel like they're shouting when they're actually whispering. We need to keep those signals and those nerve fibers going. Now, maybe medicines are being taken that can affect the cognition and focus. I think that's also important we should look into. So again, always addressing if a medicine can make something worse. I see a lot of patients take sleep meds to knock them out, and then that slows down their coordination center even the next day. And so we want to start therapy, not just with physical medicines, but physical exercise. And again, this is physical muscles. We need to keep that part of improvement. A third component is safeguarding swallowing. So we don't want to develop what's called dysphagia. We want to keep these muscles early on strong, not for speech only, but for swallowing. And there are patients who can have like silent aspirations, risk of choking on their own saliva or food. So if we strengthen the muscles of the vocal folds and the muscles of the throat, then we're going to reduce the risk of aspiration when, that's becoming more advanced in the disease state.
Okay, so there's actual real physical risk that goes on when the physical aspect of what would you call it?
The muscle atrophy or
The muscle atrophy in the throat, right, area.
Yeah,
It's
I
not
think it's important. I think it's important to convey the importance that speech can precede the swallowing problems. And that's not always the case, but I think it's important. That's the majority of the time. So we try to maximize things where patients should get into not just physical therapy, but speech therapy early on. The patients need to be aware of the importance of intent with speech. And it also makes it easier to learn earlier in the disease state when the cognition is its strongest, right? So with the disease progressing, sometimes we don't think as clear, and we want to train our muscles. Like just like anything, if you're going to have an investment for your future, you want to start early with the investment and then let that build off of each other, right? You don't want to start your investment of finances in a 401k when you've already, like when you haven't contributed much to it, and then you don't have much to build off of, right? So again, these automatic responses and movements are harder to treat later on.
So there can be preventative treatment in a way, like start doing it before you even have the symptoms.
Definitely. And it's been suggested by many speech therapists that communication is not a luxury, it's a quality of life. And, there's a lot of things that we can do. There's a lot of interplay.
And what role does speech therapy play for people with Parkinson's?
Yeah, I'm glad you said that, because we need to recalibrate the voice, the volume, and the good news is it's highly trainable. The speech areas can be trained even in Parkinson's. So there are certain things that we need to talk about. One of the treatments that's so common, very well known and popular, is called LSVT, loud. And it's based on a female in her family who, when she was diagnosed with Parkinson's in the late 80s, early 90s, that they needed to do something to help improve her speech. So it's a popular program that trains patients to use louder voice to recalibrate that sensory component of volume. And unlike the traditional speech therapy that might work on dozens of small details, LSVT really focus on one single goal: voice volume. And so by focusing on being loud, the other speech elements like articulation, facial expression, intonation, they all tend to improve automatically. And it's basically as a byproduct. So high intensity and effort is the key. The program's usually like a boot camp for the voice. It's rigorous, and the standards are usually like 4 days a week, 4 consecutive weeks in a row. So you really want to keep the muscles trained. You don't want to do it for 1 day a week or 1 day and then come back 2 weeks later. Sessions are like 60 minutes. 60 minutes is individual sessions. And that's another important part. It's very individualized. They have homework. Daily practice is retained and required. And this is something that we also tell people: don't just do this once you get the exercises from speech therapy. You got to practice. You got to keep going at it. So a lot of patients with Parkinson's, their brain lies to them. And again, we have to retrain that the brain is sending a certain signal, but it diminishes by the time it gets to the actual speakers of the mouth, right? So we need to avoid that whispering, and it really helps with vocal intent, vocal effort. And that's, I think, the key part is it has to be very intentional. So it's, again, about focus as well, thinking out loud. Now, there's another program called Speak Out, and that focuses on speaking with intent as well, converting speech from an automatic function to a purposeful one. And then we also have to understand that dopaminergic medicines, the medicines we use for Parkinson's, even if it's levodopa, can actually help the muscles that are stiff or not as quick to react and have become slow, that we may need medicines to also help. So a lot of our patients need to be optimized, not just to do the speech therapy, but optimized physically with medicines so that they can coordinate facial expression and they feel good and they have that intonation and inflection. So when they feel down, they don't even create that natural inflection. One thing is the tongue and the lip coordination drills are important. And these are other speech coordination that should improve with speech therapy and also with medicines. Some of our patients go to speech therapists to get biofeedback and pacing drills. A lot of our patients, we tell them, you got to sing, you got to keep active, but it's not just about working harder. You really want to work smarter with a targeted type of therapy.
So it's a lot of just getting used to how you perceive your voice at
Definitely.
that point. Like if you were used to hearing yourself at a certain volume and then speaking based on that, now you have to retrain that you might hear yourself scream, but that's your actual uh
Voice coming out, maybe
voice.
normal.
Normal, yes.
Yeah. There's a lot of people that if they hear themselves like in a video with their friends and other people talking, then they kind of realize like, whoa, there's a big difference between what others and how others talk and then myself. So I think it's really important to also maybe have these biofeedbacks or even record yourself and listen back to yourself. And I think there's a lot of things that we can still learn from being in large groups, and there's probably new innovative ways that are going to come out to improve speech as well.
So people with Parkinson's could listen to a recorded audio and notice the real volume,
Yeah,
but
yeah,
it's just when it's coming out of their mouth that it's not properly calibrated. That's the word.
definitely. And what's actually interesting is with the videos and things like when we look at um, when we do our like with our phones, you end up looking at also facial expression, and patients aren't aware that they're more masked like in their face and that they're not moving their lips. So I tell a lot of people to get into like even facial yoga, and there's different exercises you could even do to get the natural facial expression going, which also then helps how there's blood flow to the face and the tongue and the mouth and the lips.
And in terms of therapy, what are everyday practice that people can use in between their therapy sessions?
Yeah, one of the things that me and my staff, we really focus on is reading out loud. Like a lot of us read and we read in our heads, right? But that's not going to help your speech and your vocal cords. So you really want to read out loud and read out loud daily or numerous times per day. You want to strengthen your muscles in the morning, strengthen your muscles during the midday, and even when your body's a little bit more fatigued, really focus on enunciation and cognitive processing in the evening and night. So volume drills are really important. Speak against like an ambient noise, incorporate some voice therapy with exercise. So a lot of our patients are going to the gym and they're doing push-ups or they're doing light weights. You may be, counting 1, 2, and you're doing it with really big intent, and you're not trying to rush through your physical exercise nor your speech. You really want to focus on loud, coordinated movements. The other component is when you are also exercising, whether it's physical or it's the vocal part of it, breathe like a focus with your breathing, especially before you speak. A lot of patients feel like they have to get words out quickly because they get tired and fatigued. But take breaths, and a lot of our patients don't take deep, appropriate inhalations. And I've learned from singers actually that say they speak on exhalation. So they take a deep breath in, and then they talk while they're exhaling, and so that really helps. And another trick I got from some singers is that the carbonated beverages that are sugar free, limes and lemon, you really want to make sure you cleanse your palate. And if you have eaten something, you don't want any food or residue in your mouth because that will create more saliva. Is to even rinse your mouth after eating, and that can help with preventing the kind of buildup of saliva that's very excessive in patients with Parkinson's. One other aspect would be pause instead of rushing. You want to do regular warm-up exercises throughout the day or when you're meeting people. And patients, like I commented earlier, they may have a lot of saliva, phlegm, nasal dripping actually, or we call it postnasal drip. So the parotid glands themselves and some submandibular glands, they overproduce the secretions in the mouth. And it really irritates. Those secretions are meant to be really, there's a lot of enzymes in our mouth. Those enzymes from the salivary glands are meant to break down food so we can break down the nutrients to actually absorb them. But they're not supposed to be in our throat. What happens is it gets thicker and phlegmy in the back of our throat and it irritates the lining of the throat. So the muscles of vocal cord are not as strong. they get inflamed and irritated, and patient's speech comes out very hoarse. So if anyone has some postnasal drip or random coughing events, that means you should talk to your doctor, because that postnasal phlegm is kind of sitting here and it needs to be controlled. A lot of our patients come in and we give them tiny little injections of Botox, and that reduces the gland from overproducing the saliva. That obviously irritates the back of the throat, and that will eventually improve speech at 3 months at a time, but it makes it easier. So one friendly tip is small routine matters, and that helps more than just a perfect performance. You want to keep at it.
It's like you want to exercise your voice and those muscles so that with time, it probably does get better, right? Just like it would when you exercise your body. And
Definitely.
Dr. Thakkar, is there a particular reason why these glands are overactive or they overproduce these secretions?
Yeah, actually, we find that the abnormal protein that's linked to Parkinson's, the alpha-synuclein, is actually found in the glands too. It's in the skin, it's in the brain, it's actually spread all throughout our gut lining. So the alpha-synuclein protein, it disrupts the normal homeostasis of the gland, and the gland overproduces more than it should.
Well, that's so interesting. So many little things that are happening all at once.
Yeah, if we took a biopsy actually of the salivary gland, you can find that 60% of the time you can find alpha-synuclein in there, and that could be used potentially as diagnostic purposes. But, it's not easy to just go ahead and take a biopsy of that gland.
And for the listeners who still struggle despite therapy, what tools or approaches can help them?
So there's portable voice amplifiers, there's speech apps and cueing tools that exist, there's video chats for practice, or try to do more smaller groups and plan out events with meeting in like a quieter environment where there's less background noise. But, it's really about even meeting with support groups to emphasize communication. We need to, use different tools, but also our friends and family that are around us. So individuals with Parkinson's experiencing this low volume, a portable voice amplifier can be quite life-changing. These devices reduce the physical strain that you have to, shout, and they help ensure that you're heard even in a noisy environment. So there are different voice amplifiers that are out there. The ones that I looked up and that we talk about with some of our patients, and also talk with a speech therapist, because they may have some other tools for you. But some of the typical versions that are out there for these amplifiers, one's called Chattervox, not Chatterbox, but Chattervox. And it's pretty well known amongst the speech language pathologists. It's designed to kind of reinforce that voice. And it's a waist-worn belt pack with a high-quality headset that can boost the volume up to like 18 decibels. There's a Luminod Spokesman, which is a brand that's longtime favorite for a lot of patients with Parkinson's, because it has a simple use, one large volume knob, and is highly portable and clipped to a belt or one on a shoulder strap. Another brand is Windbridge. It's more modern, budget friendly, and there's a digital option to it. It's also comes wireless, and so there's no cords between the headset and the speaker unit. And so that makes it nice when you're not getting tangled up with the wires. And another brand is called Zoetech, and there's a Zoetech Mini. It's very small, lightweight, quite affordable as an entry-level amplifier. While it may not be like as professional sound or sound fidelity like a Chattervox, it's portable and it's okay to use casually at home. A different approach actually is something called SpeechViv. And SpeechViv is unlike your standard amplifiers that just makes your voice louder. The SpeechViv is actually a small wearable device. It's kind of like a hearing aid, and it uses this effect called the Lombard effect. And that Lombard effect is when it plays a babble noise in your ear only when you speak. So it triggers the reflex of you wanting to speak louder and more clearer without having you to think about it. And it's covered by Medicare and the VA. And I've actually worn it in the clinic. Someone came by, and I thought it was pretty innovative. So again, you can imagine right now you and I talking one-on-one, and I can hear you clearly. And maybe my voice drains off, but if I kind of had some noise behind me that's irritating me, I have to like speak with more intent. So you don't have to always force yourself to think to speak louder. So there are some important things to choose when you're shopping for some of these amplifiers. Is that the physical knobs, the weight of it, if it's wireless or wired, and the appropriate feedback suppression. So sometimes people feel it's frustrating to actually have like a microphone or high-pitched squealing from it. So again, each to their own. It's worth trying. And again, talk with the speech pathologist or therapist that you're working with. So technology can supplement the therapy, but it's not meant to replace it. You need to still practice as much as you can.
I didn't know that it's also hard for them to speak louder. I thought that it was their perception that wasn't the same, but I didn't think that if they spoke louder, it felt like they were shouting, like they had to do an extra effort.
Yeah, it gets tiring. It's like an extra chore. And again, there's a physical manifestation of feeling like even with walking, the legs get tired easier, or some of our patients, when they're chewing a lot or chewy foods, the jaws get tight. And again, it can feel like you have to work harder with your voice as well.
And for the caregivers listening, what's the best way to support someone with speech changes?
So what we suggest as far as that, as a caregiver, be patient, try to avoid the correction, be mindful of like maybe doing exercises with them. I think one of the things is like, well, it's pointing out that your voice is softer, and, maybe asking like clarifying questions, not just a yes and no, so you can get them to practice speaking more and thoroughly, maybe using more visual cues or gestures, and also practicing the speech therapy exercise with them. That may be helpful, but encourage, practice gently, go with them to the speech classes. And it's also very important, like, to follow up with the speech therapist's recommendations, because they're valuable. And a lot of patients may hear certain things, but they may not write down all of the home exercises that should be done. And so I want the caregivers to be involved. That's always good. So again, it's an empathy type of perspective, right? Like, you want to be there, you want to coach them. So communication really is a two-way street between the patient and the caregiver, and both voices do matter.
Yeah, and like you said, I guess it's a lot of just creating a safe place and a safe environment for the person who's having trouble speaking to just explore different volumes and different ways, and just being patient with them, right?
Yeah. No, I mean, as the disease progresses, it's also hard to enjoy things because it's not just a physical issue, right? We're talking about speech. So, I like to go eat. I have a big appetite, but if I'm going to go out and I'm not going to be heard, and it's kind of like one of those things where you don't feel like you can have a fun social event, why go out, right? So, you don't want to miss out on the enjoyment, but I say plan ahead. Even as a caregiver or as a patient, be mindful that maybe pick a restaurant that isn't typically so loud, or get a corner area or a booth that maybe it's not as distracting, or maybe there's TVs like with a game on. Like, you don't want to be at a place where you can't really be heard. So I always try to suggest for our patients, like, go out and make it like, whether it's a date night or it's going to be like just 2 or 3 couples, like, it doesn't have to be a huge party too. But again, we want to keep that motivation that patients can go out.
Thank you so much, Dr. Thakkar. We've reached the end of our episode. Is there anything else that you would like to add?
Well, before you get Parkinson's, the things that can make your muscles weaker and your voice worse is other health conditions, other respiratory conditions. Don't smoke. If you do smoke, cut it out as soon as you can. Make sure you're seeing a pulmonologist in case there's other respiratory problems that could affect. And maybe that, shallow breathing or voice issues could also be an underlying pulmonary condition that could be aggravating one's Parkinson's voice problems. Also, GERD reflux is also a big part of this. So, you talk to the neurologist and ask him what's neurological, what's not. And we also have to think that there could be medicines that could be maybe started, more dopamine therapies could actually help the speech. And we just don't realize it sometimes that some people do get a really good response. So we have to think of the person as a whole. If there's other health issues and conditions that can affect people, we have other people who have heart problems that they go into heart failure, and that again, fluid overload will affect them. So again, exercise. It doesn't mean just physical parts of the muscles of the arms and legs. It can be the voice, and that's really important.
Thank you so much for all that you've shared with us today, Dr. Thakkar. Every voice tells a story, and Parkinson's shouldn't erase that story. If this discussion gave you insight or tools, share it with someone who feels unheard. And remember, communication isn't only about speaking, it's about being understood. Thanks for joining us on The Caring Neurologist.